In Peggy's case, she had been on CPAP machinery, and her tolerance wasn't ideal. So one of our goals was to try to make her tolerant of her machinery, to prevent the side effects and complications where a patient's not able to wear their machine. And in that case, I did what's called a phase 1 surgery. And phase 1 surgery included nose surgery, in which I was able to open her breathing passages for her comfort so she could breathe freely, but also allow the machinery to work successfully for her. Second, I did a soft palate surgery, a technique in which I opened the throat breathing passage. If you think about that, when you look back in your throat, you've got a soft palate that hangs down with what's called a uvula. And the method is to try to open that passageway so that it's open to the throat when you're breathing at night. So I did soft palate surgery. And lastly, I did a radiofrequency treatment to her tongue. And what that does essentially over time is it shrinks down the back of the tongue, allowing more room in the back of the tongue for breathing. That combination is called phase 1 surgery, as we're discussing today. And in her case, it had a very powerful and successful improvement in her machine function, and also in her CPAP tolerance and in her CPAP numbers. The results of the procedure were that she is breathing well through her nose, she feels great, she is able to use the machine successfully and comfortably, her sleep apnea is markedly improved, and in Peggy's case she had a very unique late sequelae of sleep apnea known as pulmonary hypertension. And those parameters, I think, have dramatically improved, and we're working through that. And pulmonary hypertension is a well-known complication of late untreated sleep apnea. And as a result of that, that's had a dramatic change in her overall medical well-being, I think.